Victoria and we get you guys talking about it, she's going to go over all the costs. But tell me more about what your thoughts are on costs for dentistry. Oh, no, I just want to know. Okay, well, when we get up front, we'll figure it out for you. Now we're up front and they say, how much is going to cost? Or you're not the dentist, that sort of thing. They go, well, total cost, and let's say you know the amount, then give them the amount. But if you don't know, give a range. Total cost is $2,000 for everything. How does that sound to you? Right, there's your question. Now they say, oh, I can't afford that. I can't afford $2,000. Now we're an objection. So now we go, listen, and then cushion. So when we're back here, how much is it going to cost? It's a great question. I'd be happy to help you figure out that. Somewhere between $2,000 and $3,000 we just take care of. How does that sound to you? Oh, gosh, I can't afford that. Well, I get it. We all are figuring things out these days on how to make these things affordable. I can see where you're coming from. This is my job, though, is to help people figure out how to make it affordable for them. When you think about $3,000, are you thinking about, wow, that's a big amount, or are you just trying to figure out what can I afford per month? What would they say? That's that either or question, right? And then they go, whoa, maybe I could afford it on a monthly payment, are you saying? Yeah, that's an option. Let's talk about that. Now, typically, I've already done the pitch to 3, right? We've already done case presentation formula, so I've already said you could prepay, say, 5%. You could pay at each visit. That would be, $1,000 for each visit for 3 visits. Or you can make payments, 12 months, no interest on $3,000. That equals, right? You're down to $250 a month. How does that sound? Oh, I can't afford that. Now you go listen and cushion, you walk through it. Does that make sense? Okay. Questions about that part of it? They say, you go to either or, they go, yeah, I need to phase this or whatever it may be. Then you go figure it out, question. You get to a place where you go, yes. Now, $100 a month, I can do that. Okay, we'll do 12 months no interest, $100, and we'll figure it out. And then in 12 months, we'll do the second part. We're phasing treatment now, and you answer confirm. Would there be anything else that would keep you from getting this done? Would there be anything else standing in your way of moving forward with this? Does this sound like a good enough solution for us to go ahead and get you scheduled then? Because we don't schedule before financial arrangements, right? It doesn't make a whole lot of sense to get them on the book schedule if they haven't said how they're going to pay for it. All right. Now, have you heard this one before? Will my insurance cover all of this?
Yes.
Now, you guys are fee for service, right? You got a mix. You got a mixed bag now. You got both. You got some fee for service, some not. So do you get this?
All the time.
Okay. Will my insurance cover, and what's the key word? All of this. Yes, they cover everything all the time, just like every other insurance company ever did, right? Have you ever used your car insurance before? Have you ever had an accident where you had to use your car insurance? Okay. Did they cover all of it?
No.
Okay. Have you ever had to use your medical insurance before?
Yeah.
All right. Did they cover all of it, or did you have to pay something? So this is not an accurate perception. There is no insurance company that covers all of anything. It doesn't happen. But in dentistry, they hear, oh, it gives you 2 free cleanings a year. That's a misconception too, right? That doesn't make a whole lot of sense. That doesn't really exist. They cover something, because we could go charge $1,000 for a cleaning. They're going to give you 2 of them? I don't think so. It doesn't make any sense. So patients don't really have a good understanding of what this is. So if you hear this question, you got to recognize something. Is it an objection?
No.
It is what? It's a question. Yeah, it's a question. And how are we going to answer the question?
Tell me what.
Yeah, with a question. So, will my insurance cover all of this? Well, tell me about your insurance. Tell me what you know about your insurance to cover it. Is it the expectation they've shared with you they're going to cover all of this? Right? Then they answer back. And they go, oh yeah. Oh yeah, absolutely. I only do what my insurance covers. Have you heard that one?
Time.
I do it. Well, so you're doing nothing then, is what you're saying. Right? So we go to the formula. So doctor, why don't you be the patient and you do this. You just say this to me, and we're going to go through each step, okay? I'll take a step to my left every time I move through listen, cushion, question, answer, confirm. So you guys follow me, okay? All right. So how do you feel about moving forward with this, Orva?
Well, I just, want to know, will my insurance cover all of this?
That's a great question. Tell me about your insurance plan as far as covering procedures and that sort of thing. When we talk about restoring teeth, what do you know about them?
I think it's to my husband. I have no idea.
Okay. So really, you're just not sure.
No.
Okay.
But I kind I think you guys will help me with that.
Absolutely, absolutely. Look, we're here to help you. And I think it's important for us to figure that out. So total cost doesn't matter. Let's say, doesn't matter what it is, right? It's a big number, whatever that is. Your insurance maximum, do you know what that is? How much the most they're gonna pay out of pocket, no matter what?
1,500.
$1,500. Okay, so you know that. So no matter what you do, that's the ceiling. So will your insurance cover all of it?
No.
No, it's gonna be more than $1,500, right? And how many years did you say it's been since you've been a dentist?
Probably 10.
Oh, a long time. So think about how many years of $1,500 we don't have access to now. So what they do is they say, keep going to the dentist and you're gonna be able to maintain your health. But when you've missed time going to the dentist, we're not paying for that time you missed because you know, whatever it was, you weren't paying premium or whatever it is. They don't want to back pay anything. So you're not gonna get those 10 years back. So now what we have to do is figure out how to get you caught up so that next year you can use that $1,500 to maintain what you have, health. Does that make sense?
Yes.
Okay, so total plan, looking at it here, is $6,000 to get everything healthy. Now you have $1,500 of insurance used up. We're down to what? $4,500. Now the question becomes, how do we make that part affordable for you? So when you think about that, you go, $4,500, what are your thoughts?
I don't know how I'm gonna pay for that.
Okay, so now we're into objection.